Hi guys, welcome to the video. Today I'm going to be sharing with you some of the pros of being a medical social worker. If you're interested in knowing about some of the benefits, some of the great things about being a medical social worker, keep watching the video. Okay guys, my name is Ajane. Welcome to my channel. Today I'm going to be discussing with you some of the pros, the benefits, the pluses of being a medical social worker. What does that kind of look like? What are some of the things that I personally enjoyed working as a social worker in the hospital or in clinic, OBG outpatient setting? So guys, I have my list here. If you see me looking down, that's because I'm reading. So a little bit about me, if you've never seen any of my social work videos, is that I currently work at a hospital. I work in a hospital setting. I have a very unique job where I work in a hospital on the maternal fetal unit floor while also splitting my time also working in a clinic outpatient setting. So I am very blessed because I get to experience so many different things, so many different umbrellas that fall under the maternal fetal unit. Is the NICU and the labor and delivery and the postpartum floor and the women's evaluation unit, which is like an emergency room specialized just for pregnant women and postpartum women. And I also work at an outpatient clinic as well that does and specializes in prenatal care, OBGYN, OB outpatient care. So I work in a lot of different areas and kind of like fields under the umbrella of a unit. So that's just kind of an overview of where my current job is, what I'm kind of doing, the different places that I'll be talking about during this video so that you kind of have a general understanding of what I'm talking about. If you need any clarification, please do not hesitate to comment down below. Subscribe to my channel for more social work content and videos. I'm gonna try to film a day in my life. As a social worker, it is very difficult because of confidentiality and all of those other things, which I'll get into later. But today we're going to focus on the pros of working in a hospital setting. So because I work mainly and I spend a lot of my time with the clinics and the outpatient setting, like the prenatal care appointments. If you were pregnant, you would go to a doctor. I work in that type of doctor's office and clinic, they call it. And that allows me to have consistent hours, and I know what my work days look like, and I also kind of know what my pay is going to look like. There are some social workers who are salary, and that can be a great benefit for them. However, some of us are hourly, which is I'm one of those hourly workers, which I thoroughly enjoy, just because if I do end up working more hours throughout the week, I know that I'm going to get paid for my time and my energy and my efforts. Sometimes I feel like salary workers kind of burn out a lot faster than hourly workers because you don't really see the harvest of all that you sowed into. So I like that I have pretty set and consistent hours. My clinic opens up at 8 o'clock to 4:30. We do not accept patients after that. I am not accounted for after that. I do not work weekends. I've never had a job that I've had to work through the weekend. I've had to work some events and some weekend days, but in this specific job working at the clinic in the hospital, I don't work weekends. I've never worked a single weekend since working there nearly 2 years now. So I really do enjoy that. I like that when I'm off, I'm off. I'm not a PRN, so I don't get called in. I don't get bothered outside of the work hours, but that's what I really like. I really like my hours. I like how flexible it is. I like how kind of like fast that I accrue PTO, and I've never been denied PTO. And I'm also an overachiever and a worker. I don't really like taking off, but baby, when it's time, I'm off. Hospital has competitive compensation. I've interviewed even this year with some other organizations that were not hospitals, and a lot of them were just like, we cannot meet your pay, your current salary, what you're getting paid hourly, just because of the hospital setting. I constantly get raises and bonuses, and that has been a great benefit. I've never experienced that on that type of level, to be getting bonuses. Like, we got a COVID essential workers bonus, which was a great blessing, something that I wasn't expecting. But that's something, most things that happen in the hospital setting is that, like, you'll get bonuses, you'll get opportunities to possibly make additional money, to take up more shifts, and to interact with other people, to maybe increase your hours and things like that. So hospital compensation is great. It's very competitive, and it definitely takes you up a higher pay grade compared to some other jobs. So because I work in the hospital setting, obviously a hospital never closes. That would be kind of tragic and scary if they did. However, because I work in a clinic setting, I do get major holidays off. I do not get every holiday off. However, I do get major holidays off. So I get Christmas, Christmas Eve, Thanksgiving, Black Friday off. I get 4th of July off. And then sometimes if the hospital is feeling a little generous, they might give us, like we got the Tuesday after 4th of July or the day after 4th of July, which was great. So that was a really nice benefit, a really nice surprise, because the year before we thought we were getting it and we didn't. So sometimes you might get even more days out of the year. However, to that, I do want to say that you will have to use your PTO, or you just have to go without pay on those days. But it is nice to have holidays that I don't necessarily have to worry about needing to work on Christmas Eve or work on Christmas, or I worked last year on Christmas and now I don't have to work. It's just like I already know that I'm getting these major holidays off and I don't have to worry about that. So that's nice that I already have that information. They give us a list at the new quarter or the new year, calendar year for the job, so that I already have all of that information and I'm already aware of what days I'm already scheduled to be off. So working in a hospital setting, a lot of hospital social workers have a specific unit or floor that they're assigned to. So I'm assigned to the maternal fetal unit, and I work with pregnant women, I work with prenatal care, I work with postpartum women. So I fall under everything under that category. However, I'm exposed to so many other different populations within the unit. So I'm working with women who, I specialize at a clinic, who have substance use disorder or opiate use disorder. And I also deal with mood disorders, and we work with high-risk pregnancies, and we work with homeless women, and we work with women who have postpartum depression and anxiety. And so I'm exposed to so many different things. I am unfortunately exposed to women who deal with trauma and who are in a domestic violence situation, or who themselves have been sent into the ER because of harming a child, or whatever the case may be. Although those things are unfortunate, I do get to have experience and exposure to several different things. I'm not just with pregnant women who kind of like have it all together. There's women who out there who are kind of have most of their things together but need some additional support and resources that I can provide them. And there are some moms who themselves will say, I don't have it together. I didn't expect to get pregnant, and so I'm needing help with finding an adoption or foster care or whatever the situation may be. We help out with that. So although I'm not limited to maternal fetal unit, I'm hired on unit floor. I work with just so many different types of people, populations, and cultures. So that's amazing to be exposed to that, to learn how to work with translators and different cultures and ethnicities, and continuing to expand my range and my professionalism. So working with a large healthcare system is a benefit in itself. It's a pro in itself, because you're then connected to so many different agencies, so many different people, organizations. You understand grants, and you're exposed to so many things, so many different doctors and fields and people who in the community have small businesses and want to help and assist and provide care and support for your patients. And so you are really just exposed to a lot of a whole different world. The healthcare field is huge, and there's a lot of doors that can open working in the healthcare fields. And I personally think that if you work in a healthcare field, because it's so diverse, because you work with so many different people, and it means that you have to be really like an independent worker, good communicator, good on your feet, good at problem solving skills, then you kind of really are a key in for most other jobs, because you're just exposed to so much working in a hospital setting. Even if you're limited to a certain floor or area, like I said, you're exposed to so much. So your professionalism, your rapport with other organizations and things consistently grows, and people look at you, I think, in a lighter light, because if you can work in the hospital, then I think a lot of people, that's what at least my experience has been, doing interviews, is that they're like, oh, you work in a hospital, so you must know how to do this, or you must be familiar with this. And I'm just like, yeah. So it is a lot easier to be connected with resources. Like, I don't necessarily have to work as hard, because a lot of people come to us so that their resources, that their services, that their organization can be used and utilized with our patients, with our healthcare fields, and that we can get the word spread around the hospitals. Because when you're working with a large healthcare, you're not just limited to one hospital, you're connected with all the other hospitals under that healthcare organization. So that's amazing that I'm exposed to so many different organizations, things that I never knew about working prior to working in the hospital, is that I don't necessarily have to work for it. And I do seek out other and additional support and resources for my patients. However, a lot of the things that I need and that are most common are, I have connections and relationships with those people because they've already been connected with the hospital for several years, or they've reached out and established relationships. Like, I didn't necessarily have to do that. So that is a benefit, because it does free up a lot of my time in order to just focus on making sure that those resources are useful for my patients, and spending more time with my patients instead of spending more time on the computer looking up these places and trying to call people and get connected with people and build reports. So that's a benefit and a pro in itself. So if you're a person who doesn't like the same schedule, if you aren't necessarily a person who thrives on like a boring routine, sitting at your desk, eating lunch, talking with a few patients, or talking on the phone, if that's not something that you enjoy, that's perfectly fine. I personally love a balance. I love being able to be active and interactive with my patients. I love being able to see them. I love being able to go to different buildings and meet different coworkers and things like that. And so that's amazing. But also, you do get busy. So if you are looking for a job that's going to keep you on your toes, that's going to keep you active, that's going to keep you constantly learning and grasping new concepts, new ideas, keep you open-minded, then this is a great job for you. I want to just say that it's not going to be the same thing every single day. You're going to have different things. And although you might start your morning routine and the closing routine the same, like finishing notes or opening your email and things like that, the day that happens in the middle, the things that happen in the middle are pretty much never the same. There's rarely dull days that I experienced working there for the last 2 years nearly. And it's always kind of like an adventure, or like, what is going to happen today type thing. What am I going to learn today? What am I going to have to be challenged with today? What am I going to have to, it's new. It's every day is kind of new. Every day is a new adventure. And so if that's something that you like, something that you thrive on, something that you personally want in your next job or your first job working as a social worker, then I highly suggest working in it. It is a pro if there's something that you personally like for yourself. However, for those of you who also kind of like a mix like me, I work in a clinic setting, and then when my patients deliver, or if I have a baby in the NICU or things like that, that allows me to have that balance, because I work in a specialized clinic working with women who have substance use disorder or OUD, and I kind of get the one-on-one report over the last 9 months or how many weeks they started with us. And that is a lot of just like office work, writing notes, making sure they're connected to the right resources, following up. And then I also am brought over to the labor and delivery floor to talk with them with any issues or concerns they may have, any barriers that they're experiencing and things like that. So it can be really easy to see the good side of it and the bad side of it. So you just have to find a job that has good balance. So I want to speak personally for my specific organization, just for safety reasons. I'm not going to say that right now where I work, but however, I am going to tell you that my specific job has been more flexible with my coworkers and even myself with timeout, bereavement, COVID adoption, and allowing people time off when they needed, encouraging mental health breaks, encouraging breaks throughout the day to like take a 5-minute walk if you need to, and just promoting overall wealth and wholeness and mental health and positivity and self-care. And so I know personally that my hospital definitely puts a lot of emphasis on things like that. And so it's easier to talk to your coworker or your boss and be like, I need a mental health day. I'm going to take a PTO day next week. And they're like, okay, you need to do what you need to do, because working in a healthcare field, no one wants their boss to come see them in the hospital. I think that that's also a benefit of working in a hospital setting. And you also get a lot of medical advice, and you get to understand a lot of things that maybe you had questions with, or maybe your family and your coworkers or your doctor or whoever can give you a little bit more medical advice, or tell you like, yeah, you need to go talk to your primary care doctor about that. Like, so that's something to be a little bit concerned about. Or they can just help ease your mind and be like, oh, well, let me check your arm really quick while we're in process. And, you know, that's really nice. So a lot of what's a positive for me is that continual education is huge with my hospital. They definitely allow free classes. I can take CPR for free. I have a lot of knowledge about hospital rules, regulations, and policies and things like that. I have a lot of knowledge about the field that I specifically work in, like substance use, and you know, how doctors work and how an integrated team work and how the hospital runs smoothly and who does what. And so that is provided for us for free. We have to complete these modules every year, and we have to take a quiz and things like that. They're usually super easy. You just have to pay attention to the details, but you are exposed and allowed to have continuing education. They do encourage that you take seminars, and I'm blanking on the term, like if you have your license, that you continue to take those classes to make sure that your license stays in place. So that's awesome. Sometimes they'll even pay for it. The ones that are like more specialized for you instead of overall in general, they will help pay for it. You just gotta ask. You just gotta inquire about it. See if they have some money saved up aside for your specific area, and maybe they'll be able to pay for some of them. And maybe you just go out of the state or out of the city and go to a conference or something, and you know, tell them like, this is going to benefit us. And if it is, definitely go. So a pro that some people might think is a pro, some people might think it's a con, is that at my specific healthcare organization, I do not have to wear scrubs. I am more like casual, business casual. There are some of the inpatient social workers who wear white coats. They can wear scrubs. You have to wear the specific type of scrub that is assigned to the maternal fetal unit. However, like it's just kind of like whatever we choose to wear. So I could wear, like we have specialized shirts with our organization's name on it. We can wear those. We can wear whatever t-shirts that the job gives us. I can wear like black jeans, but they're black pants. I can dress up business. I can dress up business casual. I can come a little bit more casual. I can wear scrubs. So it just kind of depends on your specific hospital, what they require, what they need from you. So just check on that before obviously you take the job, so that if you know that you need to pay for scrubs, that you kind of put that in your budget, or you kind of know like, I'm going to be wearing a uniform in a sense as I, you know, take this job. But I don't have to do that, which is great that I have the flexibility to decide if I want to wear scrubs today, or if I want to dress up, or if I want to go a little business or business casual. Also, I don't have to worry about the maintenance of my nails and things. There's some nurses that are not allowed to have like gel nails, or like wear sandals and certain shirts and things like that. And also like you have to have your hair or your facial hair for guys, men. Being a nurse and a doctor, there are some policies that will restrict you from having facial hair and will prevent you from getting fake nails or gel on your nails and things like that. And so that's also something to consider, is being on what floor are you on? Do they require any like personal changes? Do they need your nose ring out? Do they need your tongue ring out? It just look into that stuff. But it's a pro because my job as a social worker doesn't really require much change. The next pro is that I have a team of social workers. It's 4 of us total, and we also have social workers assigned to, like, there's a NICU social worker. I think they're going to hire an additional one, and then there's like 2 or 3 inpatient social workers that handle just the more normal labor and deliveries, while I do like the more the high risk and the substance use deliveries. And so there's a team of us, and then I'm also connected with the other social workers at the hospitals that fall under the healthcare agency that I work for. So it's a team of us. We meet sometimes when we can. So just having someone that's an ally who's actually a social worker in LCSW or MSW who can help lead and guide and be someone that can talk to in place has been a good pro for us, and I'm hoping that we have some positive changes moving forward. I can do a lot of live notes. I'm able to get a lot of my notes done within that day. So I can open up and start typing when I'm meeting with the patient or write down my notes. A lot of it's live, what we call live notes, which means that as it's happening, I'm documenting, I'm, writing my notes so that as soon as the patient leaves or I leave the room, that whoever needs that information can follow up right away or read it before they go ahead and meet with the patient. Another pro is that because of the healthcare field, we know that a lot of nurses and a lot of social workers are generally more often women. So I work with a lot of women, which is inspiring, which is motivating, which obviously has its challenges. However, we're talking about the pros today. It's definitely motivating and inspiring to work with different women of different fields, of different areas, of different specialties, and to be able to know that, like, girl power. There are men that I work with as far as like doctors go and things like that. However, but like the majority of my day is spent with women, nurses, women secretaries, a lot of the decisions. However, our president is a woman of my organization, so it's always inspiring to be around so much positivity. So this is where I'm going to end it off, guys. Thank you so much for watching this video. If you have any questions about any of the benefits, any of the pros, I tried to hit a lot of like things that just popped off on the top of my head. If you have any specific questions that you want answered, please comment down below so that I can answer them, or I can make a separate video specifically if that's a really big question. I want to be able to answer it for multiple people so they can have access to it. But thank you guys so much for watching. I hope that you enjoyed, and be safe. Bye.